So the nurse just asked me to rate my pain on a scale of 1 to 10. And I'm having an existential crisis. Because what does that even mean? Is this 7 my 7 or a universal 7? Like, is there a platonic ideal of sevenness in pain that exists independent of my experience? Is 10 the worst pain I've ever felt, or the worst pain humans can feel? Because I broke my arm once, and that was pretty bad, but there are people who've been mauled by bears. So is Bear-Mauling the 10, and I'm working on a Bear-Mauling scale now? Should I be accounting for Bear-Mauling in my rating? And what about context? This pain right now is a 7 compared to what? Compared to yesterday? Compared to stubbing my toe? Compared to childbirth? I haven't had childbirth. Do I need to reserve the top of the scale for theoretical experiences I haven't had yet? Is there inflation? If I say 8 today, and tomorrow it's worse, do I have nowhere to go? Have I capped myself? Should I strategically lowball to maintain negotiating room? But here's the real problem. If I say 5, they might not take me seriously. If I say 9, they might think I'm drug seeking. So now I'm not even rating my pain. I'm rating my pain based on what I think will get me believed. And these faces, this one is smiling. Sir, if I'm smiling, I'm at a 0. Why is happy face on the pain scale? And this crying face is a 10, but I'm not crying. I'm just in pain. Do stoic people not get to have 10s? Is this discriminating against people with high pain tolerance? This scale was invented in the 1970s for research purposes. It was meant to help scientists compare data across studies. But somewhere along the way, we took a research tool and turned it into a clinical requirement. Insurance companies now demand it. Electronic health records mandate it. We're using a tool designed to standardize research, to understand individual human suffering. That's like using a thermometer to measure love. But this goes deeper, way deeper. To understand why your doctor splits you in two, we need to go back to 1640s France. René Descartes, philosopher and mathematician, has a problem. The Catholic Church controls all knowledge about the soul, but Descartes wants to study the body scientifically. So he makes a deal, maybe an unconscious one, maybe explicit. He splits reality in two: mind, consciousness, soul, thoughts. That's immaterial. The church can have that. Body, flesh, organs, mechanics. That's material. Science can have that. It's a brilliant political move. Science gets to dissect bodies without being burned at the stake. The church keeps authority over the soul. Everybody wins, except you, because medicine takes this split and runs with it. The body becomes a machine. A very complicated machine, sure, but just a machine. And doctors become mechanics, which works great for some things. Broken bone, mechanical problem, mechanical solution. Bacterial infection, mechanical invader, mechanical response. But then you come in with chest pain and anxiety. And the medical system, still operating on Cartesian logic 400 years later, sends your chest to cardiology and your anxiety to psychiatry, as if these aren't the same nervous system, as if your racing thoughts don't make your heart race, as if chronic pain doesn't cause depression, as if you're not one integrated system experiencing one integrated crisis. This is the ghost in the machine. You've been divided against yourself. Philosophers have a word for this: phenomenology. It's the study of subjective lived experience, what it's like to be conscious. The philosopher Thomas Nagel wrote a famous paper, "What is it like to be a bat?" His point: you can study bat biology, bat brains, bat behavior, but you can never know what it's like to experience echolocation. The subjective experience is irreducible. Now apply that to pain. Your doctor can see your vital signs, your lab results, your imaging, but they cannot know what it is like to be you, in your body, experiencing your pain. That experience, the qualia of pain, cannot be translated into a number without losing almost everything that matters. And here's the tragic irony. Medicine knows this. Every medical student learns about the art and science of medicine. They acknowledge that healing is relational, that empathy matters, that patients are people. But the system they enter rewards the science and punishes the art. You can't bill insurance for empathy. You can't code compassion. The electronic health record doesn't have a box for what it's like to be this patient. So we retreat to what we can measure. The body, the machine, the ghost gets ignored. And here's where it gets really messed up. My answer to this question determines my treatment. Like, we both know I'm going to do some calculus here. Studies show that if I'm a woman, I'll wait nearly 30% longer in the emergency room and am significantly less likely to receive adequate pain medication. If I'm a person of color, I'm 22 to 36% less likely to receive pain medication. And when I do, I receive lower doses. If I have a history of mental illness, my physical symptoms are more likely to be dismissed as psychological, a phenomenon called diagnostic overshadowing that contributes to people with mental illness dying an average of 10 years earlier. So now, I'm not rating my pain. I'm performing my pain in a way that I think will generate the response I need to get care. I'm performing credibility. I'm performing deservingness. I'm performing the good patient who's in pain but not too dramatic, suffering but not drug-seeking, sick but not hysterical. And you want me to do this in 10 seconds while you're standing there with your pen hovering over the chart, mildly impatient because you have 40 other patients. That's not informed consent. That's not shared decision-making. That's a hostage negotiation with a clipboard. So what would actually work better? There's a field called narrative medicine, pioneered by Dr. Rita Charon at Columbia. The radical idea that maybe, just maybe, you should let patients tell their story. Not rate your pain 1 to 10, but tell me about your pain. What does it feel like? What does it stop you from doing? When is it worst? What are you afraid it means? There are multidimensional pain scales. The McGill pain questionnaire doesn't ask for a number. It asks, is your pain throbbing, shooting, stabbing, sharp, cramping, gnawing, burning, aching, heavy, tender, splitting? Pain drawings let you show where it hurts and what type of pain it is. Functional assessments ask what you can't do because of the pain. These tools acknowledge that pain is complex, multidimensional, subjective, and contextual. But they take time. They require listening. They don't fit in a checkbox and in a system that measures efficiency in patients per hour, that values billing codes over human connection, that treats doctors like assembly line workers. We get the 1 to 10 scale. Quick, quantifiable, meaningless. This isn't just about pain scales. It's about what happens when we forget that medicine is more than measurement. When we reduce health to numbers, blood pressure targets, BMI categories, lab value ranges, pain scores. When we forget that behind every data point is a person having a subjective experience of being alive. When we privilege what we can measure over what actually matters. The pain scale is just one example, but it's a perfect example. It shows us what we've lost in the pursuit of efficiency, what we sacrifice when we treat healing like an assembly line, what happens when the ghost gets ignored and we're left with just the machine. So what's my pain level? Physically, maybe a 6. Existentially, from being asked to quantify the unquantifiable while navigating a complex power dynamic that determines whether I receive compassionate care or get dismissed. From being treated as a data point instead of a person. From 400 years of mind-body dualism that split me in two and then forgot half of me exists. That's a 10. I'll tell her it's a 7. She'll write down 5 anyway, because that's what happens when you try to measure the immeasurable. When you reduce suffering to a number. When you forget that I'm not a machine with a ghost inside. I'm a person having an experience. That can't be captured on a scale of 1 to 10, no matter how many times you ask.